Hello, we're back for breast reduction video number 2 with my favorite mug that has a person on the computer in the bed. That's supposed to be a cat. I don't have a cat, but it's basically me living my best hermit life. All right, so before we go into the video, this is a little introduction. This video and this series is really my experience. It's vlog-like. I'm sharing about my specific thoughts around it, the things I've done, the things I want, how it's going, how I'm feeling. So while there is some practical information interwoven throughout, it's not necessarily structured in the best way in terms of giving tips or sharing advice. So know that. And I am going to make a video though that is more bam, 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 to the point. Those are like finger bullet points. And giving more of an overview and things that are more easily applied to everybody's experience versus going into my own. So when I have that ready, I'll put the link down there. It may or may not be there when you're looking at it right now, but it will be there soon. Now, onto the vlog. I had my consults. I had my first and only consult. The only one I plan to have, which I know, ideally, I would be the one to recommend myself and others to have more than one. However, for me, based on the fact that my insurance is very limited in terms of who it covers, like I know there's not going to be that many more plastic surgeons in general, but especially female plastic surgeons that are covered under my limited insurance, and how much I liked the surgeon and doctor, I'm done. My research is over, I had looked up, I have a whole spreadsheet that I made, which I might share just because it's for people that are in Colorado and want a list, but it's based on who was covered by my insurance specifically. And I had looked at everybody online, I'd called different offices, and here we are. So the consult went well. The care team was awesome. Both the surgeon, the nurse, the person I talked to for scheduling, I felt very participated with. I felt very seen, very heard. They took time to answer my questions. They, were like, oh, those are some great questions that you're asking. It just felt very relational. It felt very relational, which is something I personally love in general, but also especially would need from someone who's gonna alter my body. And I'll share the name of the surgeon once the surgery is complete. We never know how everything is gonna go, so I would rather wait to really sing my praises and send referrals until it's done, in case, I don't know, you never know what happens, right? So anyway, she was great, the team was great, and the consult overall, I think, lasted about an hour. So first, the nurse came in and asked me some of the basic questions that they are usually asking really for insurance purposes. So it was, do I have a rash because of the breasts? Do I have indentations in my shoulders? Do I experience any pain? Have I gone to PT or OT? Those really literally insurance questions that insurance will want to see that you have done some of these things in order to approve you, because you've done, I think it's called CAM, is an acronym, which stands for Complementary and Alternative Medicine, which I had to Google. And I've also heard it referred to as conservative treatments. So like I said, that's things like taking ibuprofen. Apparently they ask if you've taken NSAIDs to try and help. NSAIDs, don't ask me what it stands for. It's the ibuprofen meds. If you've gone to PT, if you're wearing bras that have thicker straps and stuff, all these different conservative treatments. We all know it's a little bit of a scam because those things aren't actually going to solve the problem, but that's the hoops that insurance often makes people jump through. The main thing I have not done that's on the list is PT. So fingers crossed, they'll approve me anyway. Some insurances will approve you even without that because you meet the other criteria in terms of pain, in terms of how many grams can be removed, the pictures they send in. Other insurances can be quite strict with have had PT for a certain amount of weeks or months. So it really depends. But that's what the nurse was asking, was kind of all these questions. She asked my medical history, my family's medical history. So reviewing kind of what I put in the patient intake form, flagging anything that's either breast cancer related, which fortunately there isn't in my immediate family, blood disorders, those kinds of things. And then after that, the doctor came in and started explaining the surgery. And this is obviously going to be different from doctor to doctor in terms of how they do their consults, but I had a very long list of questions, which I'll show you like the length of my notes. I will also have these written somewhere for folks so that you can use them for your consult as well. So I had written general questions here. Very important things for me to cover about current boobs, new boobs, what I'm scared of in terms of like what I don't want them to look like. Surgery specific questions related to like the breast and like technique. Surgery questions related to like surgery, like where it is, who the team is, that kind of stuff. Recovery questions, questions about pre-surgery prep, and then ending stuff. So these are the things that I want to make sure we absolutely talked about before the session was over. And I obviously did not go through all of these. That is a lot of questions. And the main thing I would say, which it went totally well, like I don't think that I would do anything differently myself because I'd already written, like highlighted the ones that I most wanted to get answered. That was the stuff that you saw there in blue was like, I need to ask these questions. I would be happy if I've gotten answers to these questions. If you have a limited time, is keeping the questions mostly related to the surgery technique itself and what the surgeon is where they're willing to meet you in terms of like size and all of that kind of stuff. Because the recovery questions, obviously it's important to know, how much you might need off of work and that stuff. But the very specific ones in terms of like drains and what gauzes to buy, or even like questions about surgery day itself, those are all questions that will be addressed in like your pre-op appointment. You can call the office usually for, depending on how available they are. So that would be my biggest suggestion, is really use that time to talk about technique, ask them detailed questions. Two of the questions that I asked that she was surprised I asked, but also very happy to talk about as a surgeon, was what she does to prevent dog ears. So the extra flap that sometimes remains on the side, and then what she does in terms of nipple placement to prevent them from like being a little too high or looking up towards the sky, which, as someone who's had nipples that are pointing down pretty much the last decade of my life, I just want them to look, normal or slightly downward. I don't want them to be like even like you'll see pictures if you Google like, before and afters of breast reductions, but sometimes where the nipple is on the breast just ends up high. It ends up like higher. So I was asking her what she does to do that, and she answered those questions like very excitedly and talked about like the technique that she does in terms of where she places the nipple, so that when you do bottom out, when the breast tissue does drop a bit after surgery, after the swelling has come down, that your nipple doesn't end up too high. The different kind of like dimple-y kind of sutures she does, both in the medial, in the center, this part of the ink, I'm pretending that this is the boob, right? So this side of the anchor scar and this side of the anchor scar. So it was really fascinating. We both nerded out a little bit on that stuff, and that was great. Ask questions that are focused on the surgery technique. Make sure you are clear about what you want and if they think it's possible and what that might look like. So to kind of really try and get the point across of like how small I would really want to be, I told her that if I could snap my fingers, I would be an A. And like obviously I can't be an A from a 34H slash 32JK. I can't be an A without doing basically a mastectomy. Or a free nipple graft, which I don't want either of those. So, but that was to give her the idea, you can't make me too small. We're just really emphasizing that was the biggest, most important thing for me. And with that, like at the end, like she was showing me basically like literally, it was really interesting, like grabbing the breast and showing me how much she thinks she could take off. So she was like, we can take about like half of it. I was like, okay, I had never grabbed it that way. This is very interesting. So that gave me kind of a visual how it can look like. Apparently, I also have a wide root. So people who do breast reductions, like who are interested, you'll hear that talked about. I guess it's like how far back your breast starts. So I guess some people maybe have like a narrower root, but mine is wider. I don't know. I didn't think I had a wide root, but apparently I do. So that also affects how small you can go. That was the biggest thing size-wise. Like she showed me the amount that she thinks she could take off, that it would probably be, and we talked about, how inaccurate cup sizes are and that, but to kind of like give an idea, like big B, small C kind of vibe, which if that's what happens, I will be so happy. I'm going in with the expectation that I'm going to be bigger than I want to be, just so like I'm not disappointed. We had that conversation, estimated how many grams she would be removing. And that was also funny because she was like grabbing one boob and it's like, this many grams. And then the other one, and that one took a little bit longer. She's like, this many grams. I'm like, wow, this is so interesting. You often think of surgery as something that's like so calculated and cut and dry and scientific, but I really feel like breast reductions especially are an art form in terms of both like estimating, and kind of getting an understanding of the person's tissue, but then also how you're doing it itself, like in surgery, because you don't know what it's going to look like until you're in there. I don't know. It's just interesting. That's how that part of the consult went. And then at the end, I just reiterated that my biggest thing was I want to be as small as possible. And she basically, I'm paraphrasing the words, but she was like, at the end of the day, like I am a plastic surgeon. We want things to look cute, basically. But if you tell me that you want me to go as small as possible, I will. And I was like, as small as possible and cute is where we landed. Because as much as there's that part of me that's like, I want to be as small as possible, I do care. I look at them, I live with them every day. So I do care that they look cute, whatever that means to each of us, But so that's where we landed, is as small as possible while staying cute. So we'll see. I'm sitting with that. And like I said, that was what I agreed to. And I really appreciated the fact that she was willing to say like just as small as possible in general. That meant a lot to be heard, honestly, in that way. That felt really good. So they have all the info they need. I met with my primary care physician the day afterwards. If you can do that before, do it before and already have your paperwork ready from your primary care physician. If you've done physical therapy, from your physical therapist. If you've done OT, from the occupational therapist. If you've gone to acupuncture, from the acupuncturist. Bring any and all materials that are gonna be beneficial for insurance to see in terms of deeming medical necessity to the appointment. So that's the soonest I could get in with my primary care physician. So I met with her the next day, reiterated I'd already mentioned a breast reduction to her back in September of 2025. And so asked her for the letter. I told her I would send her a message in our portal that had like a detailed list of more stuff, just because it was an appointment that involved discussions about other things. So I mentioned my training history, that I've been like strength training since 2009, pretty consistently on a weekly basis, like focusing on like back muscles and stretching my chest and like all the different things. I mentioned the CAM things, the conservative treatments, how like Tylenol and ibuprofen don't even touch me. Like it's like when I get those headaches, those don't do anything. So I sent all of that to my primary care physician in our patient portal, and now I'm just waiting for her to get the letter to me so I can email it to the surgeon's office by Monday. If not, I already have a memo on my phone to call and check in, because she had said she could do it over the weekend. Ideally, Monday or Tuesday, everything is submitted to insurance. And then because I have Anthem/Blue Cross Blue Shield, they apparently have shorter reply times, which is great. So we should hear back within 2 weeks if it got approved or not. If it got approved, I'm going to end up having surgery in February. So that is very exciting. And I had a little moment where I got sad leaving the surgeon's office, because I was wondering if like the amount that they estimated is enough based on the Schnur scale, which is what insurance uses. Because I had done that calculation myself and it seemed like it needed to be a little higher in one of my breasts in order to qualify. So we'll see. The estimate was that she would take 500 out of the right breast and 425 out of the left one. And when I did the Schnur calculation, it was 482 or something like that out of each. So, some insurances might be like, oh, it's 50-gram difference. Who cares? Others, the person at the desk was telling me, the nurse, that she's seen patients get rejected even if it was like a 30-gram difference. So we'll see. There's nothing I can do other than make sure that everything gets submitted and then wait to hear back. So that's where we are in the process. I've already scheduled certain things as if it's happening in terms of some prep. So I already have my haircut scheduled. I think it's like the week of that would be what hopefully will be the week of surgery, or it'll be a week before, depending on, if I get approved. I have a wax session scheduled, that kind of stuff that I want to happen like a week or two before. So I even wrote the 2 surgery dates that I want in my planner in pen. That's what I'm putting out there in the universe. I wrote surgery day with a heart and then surgery day with a heart option too. So we'll see. If I get approved, then I should be able to have surgery in February. I've already notified work, let them know that I'm undergoing this process and hoping to have it ASAP. And I'd probably take anywhere between 1 to 2 weeks completely off, and then a mixture of maybe like going into the office once a week instead of twice for the first week or two or something after that. And if I get denied, I can do an appeal. So I have to figure out still what that timeline looks like exactly, like within what time frame you can appeal. Like I don't know if they say if they're going to deny me because I haven't done PT. I don't know if the submission will last long enough for me to do, because I think it's 3 months that Anthem requires, 3 months of PT to then be able to appeal it, or if it's just like, denied, and then I do 3 months of PT and then start a new submission process. If I get denied because of the gram estimated size, what they were saying is I would go in for a second consult with the same person and they would like redo basically the assessment and then resubmit stuff that shows the number that basically the insurance is wanting. And the reason they said this is simply because the surgeon tends to go conservative with the estimate of grams, so that, because whenever you say however many grams you have to take out, you're going to take out, you have to take those out. So if you overestimated it, you're still going to have to take those out. So that's why they were saying she tends to go a little bit conservative, because that way, if you are someone who wanted a breast reduction but wanted to stay bigger still, relatively speaking, that's what helps that happen. So yeah, hopefully though I get approved and that's that. But this is it. This is the consult journey. I did have my aunt there. She offered to come with me, so that was really nice just to have someone that I know. So if you have someone in the area that you're comfortable being in that kind of appointment with, why not? And now it's a waiting game. So I will go ahead and put the resource that I mentioned in terms of consult questions down in the description here, down there. And then the next video will hopefully be an update to let you know that I got approved, that surgery is scheduled for the first 2 weeks of February, and that we're good to go. That's my hope, but we'll see. And I hope you have a good time in the meantime.